Hey everyone. So on January 25th, I posted a pretty long science news segment about the coronavirus in China. I explained what it was, I explained the symptoms, how it was spread, and where it was spreading. We walked through a day-by-day chronology of the outbreak, keeping track of the places outside of mainland China where the disease appeared. By the end of that day, January 25th, the number of infection cases had risen close to 2,000, and the death toll stood at 56. Now today, February 2nd, 1 week after my first science news segment about this, the virus has spread from China to most Asian countries, as well as Europe, Australia, and the Americas. The cases in these other regions began to climb, but thankfully nowhere nearly as fast as the rate in China, and this is due in part to effective screening methods at ports of entry. These efforts haven't been perfect, as in the last segment I mentioned that the first American case was an individual who carried the disease into the country before screening procedures had even been put in place. But generally speaking, the screening measures, they have been effective, and the spread of coronavirus in, for example, France or the US is not serious, and it's not nearly as extensive as it is in China. So to continue the chronology that I started in that previous coronavirus science news segment, let's look at the day-by-day breakdown of the last week. Alright, so the day of January 25th ended with 1,975 cases, confirmed cases, and 56 deaths. The next day, January 26th, would see the number of cases rise to well over 2,700, and the death toll would jump to 80. Also, the number of cases continued to rise slowly in places like the US, Macau, Hong Kong, and Thailand. The Chinese government immediately banned the sale of wild animals, and they set up screening facilities at airports, at rail stations, bus stations, and water ports, and any person suspected of carrying the virus, whether they show symptoms or not, are being put into isolation and quarantine. The Chinese CDC also began developing a vaccine for coronavirus, hopefully to inoculate people in the surrounding regions to prevent further infection and spread. Also, do you remember the Ling Hui that I mentioned in the previous news segment? It was kind of a cultural government event where people from all levels of government across the Hubei province would meet together and discuss and plan for the future. I pointed out that such an event was a great place for coronavirus to spread, and to be carried back to all of the cities across Hubei province when those same government representatives returned home. Well, I'm sad to say that I was right, as many of these people did get infected, and some of them have died. Some of the government officials who went to this meeting, like high-ranking senior official Wang Jianliang, contracted the coronavirus. They developed pneumonia symptoms, and they died. On January 27th, Dr. Gabriel Lyon gave an important presentation. Dr. Lyon is the Dean of the University of Hong Kong's medical school, and he's one of the world's leading experts on SARS and infectious viruses. And SARS is important because that's a related coronavirus. Now, during his presentation, he reported data that estimated a true infection caseload of between 44,000 and 100,000 people in China alone. This is nearly 10 times the official estimate in China, which was a little over 4,000 cases by the end of the 27th. Even more ominously, Dr. Lyon said the infection would continue to get worse, and it would peak around April or May of this year, at which point he estimated 100,000 people would be newly infected every day. Now, on the same day, on the 27th, Austria, Canada, Cambodia, Germany, and Sri Lanka each reported their first confirmed case, and Beijing reported its first coronavirus death. Suspected cases were reported in Poland, Mongolia, Romania, and Fiji. And in a very worrying turn, Germany also reported the first global instance of coronavirus transmitting from person to person with no symptoms being reported. This is a bad development because we can identify people with symptoms. We can give them medicine, we can put them in quarantine. But with no active symptoms, how do you know who's a risk? How does that person know that they're a risk? They don't. So they don't take precautions, they don't take preventative measures for a disease that they don't think that they have or that they don't know that they have. And this way, the disease can spread much easier. January 28th, more cases appear in Thailand, and the country's health minister, Anutin Charnavirakul, said that their health services are not able to stop the spread of coronavirus. More cases continue to appear all over the world, including Japan, France, Brazil, Canada, and Singapore. Also, in Germany, the asymptomatic spread continued, as 3 more people became infected, who are all co-workers with the person who was infected yesterday. The global caseload swells enormously, with more than 1,000 new cases since the day before, to nearly 6,000. About 24 to 26 people are dying every day at this point, and the death toll, at least the known death toll, at least those figures that are known or reported, now stands at 132. January 29th. After a suspected case was identified and reported in Tibet, all 31 mainland provinces of China have now reported coronavirus infections, so it's across the country. In Hubei province specifically, which includes the city of Wuhan, where the coronavirus outbreak began, it's ground zero, in Hubei province, the schools are closed, public services are all shut down, and commercial activity has largely been put on hold until February 13th. It was February 9th, but they had to push the date back. More cases continue to show up all over the world, including the first cases in Finland, the United Arab Emirates, and Armenia. The global infection count has now exceeded 7,700, and the death toll has jumped to 170. January 30th. India, Italy, and the Philippines all report their first case. Germany reports another case at the same company as all 4 of the other patients, and the US reports its first case of human-to-human transmission. In China, Hubei province is frozen under a quarantine, as the last of the major public roadways, bus services, and rail lines are shut down. The infection caseload across the world is nearing 10,000, and the death toll has reached 213. January 31st. The UK, Sweden, Spain, and Russia report their first cases. China announces that patients who were previously infected but have since been cured are susceptible to reinfection. And that's really not good, because if people who've already had it are still susceptible to reinfection, that would suggest that people aren't reliably developing resistance to it. And that doesn't bode well for vaccine research either, because if people don't develop a resistance from the bacteria itself, it's not likely that a weakened or a dead specimen of the virus in a vaccine is going to somehow make them develop a sufficient resistance. As a deterrent against further infection, Wuhan residents outside the city, so those living in other provinces or those who live in other countries, are being repatriated back home. The infection caseload is now reported to be 11,791, and the death toll is reported to be 259. February 1st. The caseload around the world continues to get worse, with more cases popping up all over Asia, in Australia, and in the US. In China, officials are now working to regulate and disinfect wastewater and sewage, as a patient's feces was recently found to contain living coronavirus. So that means it can live through the human digestive system, and it can be excreted alive, and therefore can potentially be recycled. It can reinfect somebody and re-enter the population. More than 2,500 new infections were reported on February 1st alone, putting the total global caseload at 14,380. The death toll has now exceeded 300. It sits at 304. The first coronavirus death outside of mainland China is confirmed. This case, in the Philippines, was a 44-year-old man. His spouse was also infected, and she was actually one of the first case reports in the Philippines, and their story led to the early suspicion that human-to-human transmission was possible. This also shows that the virus is capable of killing middle-aged people, and not just the sick and the elderly. Because it's the middle of the day of February 2nd, I don't have the latest infection and death toll updates for today. But perhaps the only good news that I can bring to you here is that one of those hospitals that I mentioned in the last news segment, the one that they started building on January 23rd, it's now more or less complete, and it'll begin housing and treating patients tomorrow, February 3rd. Alright, so what have we learned so far? When I posted my first news segment about the coronavirus, we had learned that it came from wild animals, that it was transmissible to humans. We learned that it could be transmitted from human to human, and we learned that it was fatal, particularly to those who are old and/or sick. Now, a week later, we've learned that human-to-human transmission is not only possible, but it can even happen when the patients are not showing any symptoms. Also, as the number of infection cases and deaths has grown, we've gotten enough data to start making projections and to really grapple with what we're dealing with. The Wuhan Municipal Health Commission developed a semi-log plot of confirmed cases, and this suggests that the virus is in the exponential phase of an epidemic. This exponential phase will eventually be followed by a tapering off of new cases. This will generally occur when enough health measures have been enforced and medicines and vaccines distributed, so that the spread begins to slow and ultimately stop. The death toll will continue to rise for some time afterwards, as those with infections are still at risk of death. But eventually, after the spread has slowed and stopped, the number of cases will begin to decrease as the virus burns itself out. Patients will either recover or they will die, and then one day, the epidemic will be over. We can all hope that this day comes sooner rather than later, but because we're still riding through this exponential phase, unfortunately things are still going to get worse before they get better.